Hello, everyone. My name is Abena Sante. I'm one of the senior program officers at St. David's Foundation, and I'm delighted to be part of this webinar to talk about this new funding opportunity.
Thanks, Abena. And hi, everyone. I'm Andrew Levac. Like Abena, I'm a senior program officer with St. David's Foundation, and really excited to talk to you about this open call around healthcare workforce today. And although Abena and I are your presenters today, this funding opportunity represents the work of our entire community investments team. Therefore, while we're happy to answer any questions today, Abena and I aren't the only ones you can talk with. Indeed, later on in the slides, we'll share a central email address, questions@stdavidsfoundation.org, which is really the best vehicle for receiving a standardized answer to any questions from our collective, and that represents the entire foundation's thinking. So we're really, really excited to talk with you today, and I'm gonna kick us off by a little context about what brought us here. So the next slide is a slide about our strategic plan. As you all know, we launched our new strategic plan at the start of last year. And the goals of the foundation are, as you can see, are on the right, which are very much based on our history as a foundation that is committed to health equity. And they include a focus on increasing access to quality of care, designed to advance health equity, removing economic barriers to improve health outcomes, and equipping communities to achieve their health priorities. And this particular open call is really a great reflection of all three of those goals, but was really born out of our desire to remove economic barriers to improve health outcomes and use healthcare workforce as a pathway to financially stable healthcare careers, while also improving culturally competent care and addressing health shortage needs in our community, and it being done by a community combined collaborative effort. The other thing I want to say about our strategic plan is that, you can see in these goals the what of our strategic plan, but part of our strategic plan is really about the foundation working in different ways. And part of that means the nature of this call, which is that in the name of health equity, we've really opened up our funding processes to create a more transparent process that allows collaborations and organizations to openly submit ideas to us for consideration that we can support and fund. And it also means, as you can see on the left, addressing sort of health barriers today, but also moving upstream and addressing systemic level issues to address healthcare issues for tomorrow. And so that systemic approach is also reflected in this open call. And I think the third thing I'll say about how we're trying to work differently is reflected in the next slide, which is that we were really trying to respond to community needs. And this open call is a reflection of clear needs that have been expressed by our community to support our healthcare workforce. And this, the design of this call was informed by a lot of community partners who you can see here up on the screen, as well as many individuals that we talked to as well. So we truly appreciate all of the engagement and feedback that shaped this call and that will continue to inform our strategy around healthcare workforce. So with that, I wanted to talk a little bit more about this funding opportunity in particular. So next slide. So I'm sure most of you have read the open call. It's available on our website. But I just wanted to sort of highlight a few key pieces of information about the goal of this call and highlight a little bit of our thinking that got us here. As you can see, the goal of this funding opportunity is to increase opportunities for Central Texans, particularly those from historically marginalized communities, to enter financially sustainable healthcare careers by building the capacity of collaborative region-wide pathways to securing employment that lead to self-sufficient wages. Our goal is to help Central Texas struggling to make ends meet find meaningful work in high-demand healthcare careers, enabling them to earn a wage that supports both themselves and their families. And really, there were three major pieces around our situation in Central Texas that informed this call. The first one is the obvious healthcare workforce shortage, that there is a great demand for healthcare careers and a need to address those gaps in employment to provide high quality, culturally competent care to our community. And then secondly, a recognition that many of these healthcare careers can provide stable, self-sustaining wages that allow families to make ends meet, that provide families with the stability for housing and schools, that ensure their access to healthcare coverage, that allow them to make savings for and planning for retirement and their children's education, and that those are fundamental aspects of health and health equity. And finally, a third piece that really informed this call was a recognition that for a workforce initiative to be most effective, it needs to work at some systems level. It needs to work systematically at significant scale. And therefore, it requires collaboration between organizations and sectors. It's very hard for one organization to do alone in a vacuum. And it needs to address the unique needs of communities in our 5-county area. So we need to think about how there are different needs in different counties and what opportunities can be done to address the full scale of our 5-county area that the foundation serves. So with that, I want to move on to just a few other pieces around the overview of the grant. As you'll see in the open call, the award amount is based on the scale of proposed project or program and the organization's potential for impact and the organization's annual budget. So we're looking at, we are not prescribing a particular budget limit. We do know that we have up to $10 million funded for this open call, and there will be multiple awards given for this funding opportunity. But it's really to be determined by the organization to think through the scale of what they're proposing, their capacity given their organizational budget, and the potential for what they're trying to achieve for them to make a budget request. For those who are awarded, they will receive a flexible one-time 24-month grant. And what we mean by flexibility is that grant recipients will be funded to do work around this healthcare workforce initiative, but they will have discretion on how the funds are spent as they carry out the grant purpose. They won't have to sort of adhere to a rigid budget that they initially proposed. The term is 2 years, and then the reporting requirements will be clarified during the award phase. Next, I wanted to talk a little bit about how we'll score these grants. There's an application rubric, and this is a very important piece for grant writers to consider as they submit their application and consider how this grant will be evaluated. There are 6 different categories within the rubric, which will help inform our review team in terms of making decision-making for how the application aligns with the foundation's objective. And I'll just talk about each one a little bit in detail, but really what we'd love for you to do is think about these different categories. It's an invitation for you to make a case for each of these. And we're really asking for you to define these things in a way that you see them. We honor your expertise. We're learning from you. So we want to hear how you see your work to be equity focused of and by community. We want to hear how you see this as work that's around health equity and innovation. I'll talk about each of these a little bit. In terms of the category for equity focused, we're asking here that this grant particularly focus on those from historically marginalized communities. And we want to hear from you how you define historically marginalized communities, who will be the individuals and communities that you are serving through the work that you are doing in this proposal. In terms of potential for impact, we really want you to share your idea and explain how the careers that you're supporting will be financially sustainable. We want you to define that. We want you to hear from you about how you define these careers and these pathways as allowing families to make ends meet. What are the definitions that you make for a financially stable career that can support individuals and families in Central Texas. So that's a very important piece for you to share with us. In terms of and by community, we want to know who are the partners and how are they engaged and why are they engaged? Why have you decided to partner with these organizations? What do they bring? And particularly, we want to hear, how will community members from the communities that you seek to serve be involved in development of the solutions and strategies for the work that you do. Team capacity is fairly clear, but we particularly want to hear if there is a collaborative from the lead organization to understand your organizational capacity and your staff capacity and the skill sets that you have, the history of the work that you have to carry out the work that is proposed. With health equity innovation, we want to hear about the evolution of your work. We want to hear about if you have new ideas, how those new ideas came to be. If you have demonstrated success, we want to hear about that. But we would love to hear about the evolution of your work. What has led to where you're at now? How have you innovated and how have you come to propose what you're proposing now? We'd like to hear about that learning journey and sort of the new creative ideas that you have to sort of build and affirm your work. And finally, with collaboration, we really want to know about, how will this group be more than the sum of its parts? What is the value of bringing these efforts together? And how can you better serve our community by working together in a shared way? So wanting to hear about that in terms of collaboration. So those are the pieces of the application rubric. And the application, the opportunity in the application is to actually address each of these aspects of the rubric. There will be points assigned to each of these categories for a final score that will help us in our decision-making framework for whether or not we determine to fund a proposal or not. So with that, and we can take more questions about the rubric as we go on, but I'm going to pass it over to Abena now to talk a little bit about the letter of intent.
Thank you, Andrew. For most of you who knew the foundation, we used to have a process of grant making that was mostly via invitation with a new strategic plan that Andrew talked about. We are doing things differently and we are using open calls as one way of grant making. And so before we get into what and why of a letter of intent, a question may be, why is the St. Davis Foundation even using this LOI process? It's an intentional way for us to find out who's working in this space. It's a way for us to look at a broad range of potential grantees in this space. It's a way for us to encourage and foster multi-sectorial innovation, diversity, and also community engagement. Open calls also allow us as a foundation to identify a wider range of organizations and ideas that are aligned with our priority areas. Finally, we want to learn from you because we see you as the expert. So the application process for the healthcare workforce funding opportunity is a two-stage process. Phase one is a letter of intent, and then phase two, when you're invited in, is when you submit a full proposal. So we see the LOI process as being transparent and equitable. Remember, I mentioned that one reason why we are doing this is to open it up and have eligible organizations apply. Regarding conserving time, it's twofold: conserving time for us, the funder, and conserving time for you. So with the LOI, when you respond to that one question with 500 words or less, you are told within 4 days whether you move forward to the second phase to submit a full proposal or not. And so you save time by not having to submit a full proposal and then being declined at the end. So the LOI will let you know within 4 days, whether you're moving forward or not, and you don't have to submit a full proposal. Another reason why a letter of intent is that it also gives us visibility into our community assets and partners. I alluded to that earlier. What are those assets? What are those trends? What's going on in the community around this healthcare workforce area that can help inform us and also inform the field? And we are trying something new, introduced in rolling LOI. What do we mean by that? The LOIs will be reviewed by us within 4 days. Looking and saying that 4 days, 4 days, 4 days. 4 days, you would know whether you are moving forward or not. And the advantage of you knowing earlier and submitting your LOI earlier means that you have a longer runway to develop a proposal if you're invited to submit a full proposal. Next slide, Claire. All right, so with the letter of intent, Andrew talked about potential for impact. It's important that you include a clear description of how the work that you're proposing to do is collaborative and also region-wide. You have to be really clear in indicating, what your region is and what are those pathways for historically marginalized high school youth or adults to enter high demand financial sustainable healthcare careers. And we are open to you using data to tell us what you mean by historically marginalized, region-wide, also high demand and financially sustainable careers. Next slide. All right, so we talked about the potential for impact. So the LOI, one thing, look at the rubric. It has a description of what the potential for impact is. So it has to be compelling. So to the extent to which the proposed idea offers a compelling and feasible pathway for our target population, historically marginalized communities, to enter financial sustainable healthcare careers is what we are looking for. By compelling, we mean, do you understand that target population? What is the possibility or likelihood that the proposed project will have a significant effect on addressing the issue? Are you demonstrating credibility with evidence? Do you have a strong solution to the issue? By feasible, thinking about your plan, thought, idea. Is it realistic? Is it possible? And then use all those to frame what your LOI response should be. Next slide. So this is the timeline. As you all know, you are here because the funding opportunity was released on the 26th of March. We are having the webinar today. The webinar recording, as Claire mentioned, would be available on April the 8th. And the LOI is due on the 1st of May by 5 p.m. We wouldn't be taking any LOIs after May 1st, 5 p.m. And we talked about the rolling LOI. So if you submit your LOI before the deadline, you would know within 4 business days if you're moving forward or not. And the application is due to the foundation by 5 p.m. Central Time on May the 13th, Tuesday, May the 13th. Sometime in June, you will hear from us about the proposal, whether it's been awarded or not. And then if it's been awarded, it's a 2-year grant cycle, which begins in July and then ends in June of 2027. The next slide, please. All right, so tips and guidance. We cannot say this enough. Make sure that you read the funding opportunity language and the FAQ very, very carefully and use the rubric. The rubric is what we are using to score the proposal. There are 6 categories in the rubric, maximum score of 50 points. So make sure that if you're invited to submit a proposal, your proposal responds to the, and keep your LOI response concise. And again, use the potential for impact to frame your response. 500 words or less. If you can do it less words, even better. And we highly encourage you to say it and then you show it so that we can score it, because we can't infer from what you've written what you mean or what you intend if you're not clear in articulating uh, your project. And again, submit your LOI early. Don't wait. The earlier you submit it, the longer time you would have to work on your proposal. And we have a few LOIs in already, and some folks have moved forward in writing the proposal. Next question. Oh, okay, one last thing. So the FAQ. So we will be updating that regularly. So if you go on the website and look at the FAQ today or tomorrow, make sure you go back again, because as people submit questions to add questions at sdf.org, we will update the FAQs with new information, which could be helpful to you as you craft the proposal. And the next slide. All righty. So we're on the questions and answers page. So please ensure that you're on mute. We are going to use the Zoom Q&A feature to submit questions for Andrew and I. And then you can chat SDF Tech if you have any technical issues during the webinar. So with that, I'm going to turn it over to Claire.
Thank you, Abena, for going through LOI and timeline. Hopefully that clarified some questions for folks. Thank you to those folks who submitted questions in the registration process for this webinar. We've compiled those and aggregated those into some high-level, most common FAQs, and I'm going to ask Andrew and Abena each of those, and then they'll answer them. And then if you have additional questions, feel free to use the Q&A feature. It's at the bottom bar of the Zoom webinar screen. And then we will either point you to the FAQs on the website or filter those up in the future. And yeah, so this first one is for Andrew. How can I figure out if my organization is a good fit for this call?
Thanks, Claire, and thanks to whoever asked that question. I'll say the expectation is that these grants will allow organizations to continue or expand their existing work to address workforce development. They will be a particularly good fit if the populations they're serving include historically marginalized communities, and it's very important that they are addressing healthcare careers that are financially stable. So those are sort of 2 important filters to look at. To see if you're a fit, download the documents for the call as well as these frequently asked questions. And we've designed this LOI process to sort of help identify if you are a good fit for this call. The LOI can be completed in about 30 to 45 minutes. And so, we encourage you to submit an LOI. And if you are, if you go through that process, then you're a very good fit to be considered in the application process.
Great, thank you. Also, Andrew, is St. David's Foundation looking for new initiatives or current ones?
Yes, both. Yes. I mean, We'll consider both new, current, and expanding initiatives. We are, supportive of sort of blending or grading our funding to build on to existing support that you have for a current initiative that you have. It doesn't need to be a new initiative. We want to support the good work that's already happening in Central Texas. So we are very open to figuring out ways that we, can support existing momentum. And so that's really important to us. And so that gets a little bit to what we hear in the rubric about team capacity, as well as, hearing about health equity innovation and hearing the demonstrated success that you may have, hearing and potential for impact, sort of the existing model that may exist, but we are open to new ideas and existing work.
Great. Abena, could you define some of the key terms that are in the funding opportunity, like financially stable, minimum income, healthcare workforce, historically marginalized communities, etc.?
Et cetera, et cetera.
Yeah.
We use data for impact, and we encourage you to use definitions and data that are relevant to your work and share those with us. Make that case. Then we are learning from you, as you've heard us say multiple times. So let us know how you use data to define those terms and demonstrated impact. We encourage you to use the rubric to guide how you describe your work.
Similarly, what are high demand healthcare careers?
It seems like I'm a parrot. I'm going to say we are learning from you about how you use data to define terms and your demonstrated impact. So we invite you again to use the definitions and data that are relevant to your work and share those with us. We encourage you again to use the rubric to guide how you describe your program and work, and you make that case.
Andrew, how does St. David's Foundation define a collaborative in pathways to economic stability for healthcare workforce?
Claire. Yeah, we mentioned that, we feel like the most impactful solutions, particularly around a multi-sectoral issue like workforce development, are collaborative and do require collaborations. Formally, we would define a collaborative as more than one organization formally partnering with another one to deliver coordinated services. And so that would sort of be how we would define a collaborative. An organization could also just work collaboratively with partners that it identifies for that work as well. So yeah, but in cases of a collaborative, we may actually even follow up to ensure that there is a formal MOU between organizations, and we may request down the road, understanding how funds would be distributed between organizations in a formal collaborative that operates in that way. So there's collaboration, and then there is the collaborative.
Thank you. Abena, how many grants and what range and size does St. David's anticipate making for this funding opportunity? Oh, you're on mute.
Thank you. So we have a budget of $10 million for this funding opportunity. And we will not make one award for 10 million. In the past, we've had a few applicants ask for the whole amount. So just to give you a heads up, we'll not give $10 million to one applicant. The award size will be based on the scale and sustainability of the proposed work that you described and the organization's potential for long-term impact, as well as your annual budget. So we encourage you to determine your request based on how much the program or project costs to implement this for 2 years. The realistic budget.
Thank you. And Andrew, can I submit more than one LOI?
Good question. What we would ask is that you submit one OLOI for a unique program or project. So theoretically, an organization could submit more than one if they were distinct, different projects or parts of collaboratives. If an applicant isn't a collaborative, we ask that the lead applicant submit one OLOI on behalf of that collaborative. But yeah, as long as they are distinct, different LOIs, there can be more than one.
Great. Thank you. And those were kind of the general overview questions from the registration. Thank you guys for submitting those. And also thank you for submitting in the Q&A in the webinar. And so we're going to start answering some of those questions to the best of our ability right now. A lot of those answers maybe we don't know right now. But we will point y'all to a resource that we can get back to you hopefully as a team via email. And the first question is, for this 2-year grant, is there a preferred timeline for the implementation for the foundation? For example, would y'all expect implementation of any program or pathways developed within 6 months, 1 year, or could this be a 2-year planning grant with implementation beginning at the end of the 2-year period?
You want me to take that?
Yep.
Sure. We don't have a set expectation of sort of how this work would go. We understand kind of that you are the organizations and the experts in how to carry out work. We want to support that. If what you are submitting requires planning and coordination to get it online over a course of 2 years, we would understand that. We would just want to understand the reasons for that. But we invite you to share the reality of what makes sense for you to carry out your work with the most success. And we are open to sort of sustained planning time to sort of have the collaborative and the planned work that you need. I mean, region-wide collaborative networks don't happen overnight, and we recognize that. So we would be supportive of hearing from the wisdom of your work to say what you need.
Thank you. Avina, I was wondering if you could elaborate a bit more on what we mean by say it, show it.
So say it means being clear and articulating what your proposed project is, being clear about what it is that you are trying to do or you want to do. Show it is what is the evidence? What's you have experienced? What is the demonstrated success that you have experienced? So you have to show it so that the case can be made and we can score it and give you the appropriate point. As much as we like to read between the lines, we may be wrong. And so please, as you describe the proposal, as you write the proposal, have the lens of perspective that the person on the other side viewing or reading it doesn't know anything about your work. So you say it in a way that someone can understand and get that whole picture, show it, back it with evidence, demonstrate it as it, and then that would allow us to score it fairly.
Thank you. Andrew, will this funding opportunity be re-released in the future?
Yeah, there is a long-term commitment to addressing healthcare workforce within our strategic plan. It's a foundation-wide initiative. So while we don't know if this particular funding opportunity would be re-released, our commitment to continuing to support region-wide collaborative efforts that sort of create and sustain livable healthcare careers with livable wages will continue much beyond this funding call. So yes, there will be continued investment from the foundation in this area. It's not a one and done and then we're off to something else.
Thank you. This is an eligibility question. Are public charter schools eligible?
Thank you, Claire, for that question. we have an eligibility criteria, and so if you review it and you fall within it, being a nonprofit, a governmental entity, um, who, yes, you're eligible and operate here in Central Texas.
Another eligibility question. Could grant funds be used to renovate a facility to house a training program?
And do you want to take that?
Yes, could you repeat it, Claire?
Yes. Could grant funds be used to renovate a facility to house a training program?
They could be. Well, the question would be, does the renovation of that facility address the sort of call of the goals of the call itself? So, look back at the rubric, does that, renovation of the facility allow for clear pathways for self-sustaining healthcare careers? Is there sort of broad-based collaboration and commitment? Is there a sustainable model for that work to continue? So we are not opposed to that, but we would want to understand how that particular capital project supports a larger initiative to sustain those healthcare careers. And that's a little bit about where that graded funding comes in. If that is the one missing piece of sort of a larger initiative, we'd want to hear about that larger initiative and how our support is helping address that.
Thank you. Can organizations submit more than one application? For example, could an organization apply as a lead in one application and be a partner in another application?
The answer is yes, 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 yes.
As long as the projects are different, right? That would be
Mhm.
the piece, right? So we just want clarity. We don't want, a collaborative and 3 different organizations all applying for the same project. If you're all doing the same collaboration, get together, submit as one collaborative, and have a unified voice in how we would fund that work. What we wouldn't want is like 3 different organizations who are all working around the same work together to submit 3 separate applications.
Great, thank you. How will matching funds impact the funding rubric?
So this is a 2-year funding opportunity, and we encourage you to look for other funding sources to blend grade, because we are looking at potential long-term sustainability of this work. And in one of the rubric categories, there's a question or a statement around potential for long-term.
Thank you. Speaking of the rubric, could we spend a little more time differentiating categories 3 and 6 of and by community and collaboration? And I'll go back to that slide.
Thanks. Yeah. So in terms of and by community, there is, regardless of who is sort of in the collaboration, we want to make sure that the ideas and work that you're proposing is really informed by community members, stakeholders, folks who have a vested interest in the work, including the community members from the communities that you seek to serve, and that the design of the work is informed by that. The collaboration is really about who is carrying out the work and how that work is done equitably between partners, and how those particular implementers will work together towards. So they are related. I would say of and by community is a little bit more in terms of the design and the voice that the project has and the accountability to the community. And the collaboration is a little bit more of the implementation piece of the work.
And then what I'll add to the collaboration part is that if you're collaborating with other organizations, it's important that you articulate what the added value that the partner is going to bring. Show that in your proposal.
Thank you. Another question we've got is, my organization serves Bastrop, Caldwell, Gonzales, Guadalupe, and Victoria counties. If awarded the funding, are we able to use the funds organization-wide throughout the region, or is the funding restricted to Bastrop and Caldwell counties?
So the foundation serves the 5 county areas of Buckswell, Caldwell, Hayes, Travis, and Williamson counties. And so if funded, any investment has to impact those counties within our service area.
Thank you. Could you both share some hypothetical, maybe, initiatives that would fit this opportunity?
I don't really want to get into hypotheticals. I mean, I think that that is the opportunity. Anything is a hypothetical, right? I wouldn't want to limit what that is. This is an invitation to hear all of those possibilities from the community. And so I encourage you, if you have an idea, share it, put it in the LOI. It's a quick way to get a sense of if it's something that we want to hear more about.
Mm-hmm. And think about unlikely and likely partners to help you advance what you are thinking of.
Thank you. Related to this specific funding opportunity, do you expect the proposal to have a plan for evaluating, quote, the organization's potential for long-term impact? And what would be examples of evidence of potential for long-term impact?
Yeah, we're working alongside our learning evaluation team for this call around how we'll evaluate that work. And we will work in partnership with those who receive funding to sort of play out that longer term evaluation of the work as it moves forward.
Thank you. Kind of shifting gears, a bigger picture question regarding the foundation. St. David's Foundation this morning has been clear in expressing its values to support historically marginalized communities. What is your perspective regarding expressed values in this national movement where DEI statistically focused efforts are being frowned upon, challenged, and muted? Are you sensing that this effort is an outlier?
I'll start and I'll invite Andrew to respond. So the foundation is very clear in our mission to advance health equity through investment and action. We are working on ensuring that we build a vibrant community, and historically marginalized. It's not necessarily race, it could be location in terms of rural. And we are being led forward with this effort by our board, who strongly believes in this work that we are doing to advance health equity here in Central Texas. So we know that there's that national, dialogue going on, but as a foundation, there's that commitment to advance health equity.
Thanks, Bob, and I'll jump in too. Yeah, I just want to share that our foundation remains steadfast in its commitment to addressing communities with the greatest health needs, regardless of changes in the political landscape. Our focus remains on addressing the root causes of health disparities and providing support to communities most impacted by these changes. We're more committed than ever to our work, and we remain agile in our unwavering focus on communities with the greatest health needs. And we center our work on sort of both individual and systemic barriers to health, and an intentional focus on historically marginalized identity groups that includes Black, Hispanic populations, women, members of the LGBT community, refugees, undocumented immigrants, among many. And why are we committed to this? We're committed to supporting these initiatives that reduce these barriers and improve health outcomes. We need to make sure that we have culturally and linguistically appropriate care. And so we need a workforce that reflects that. in Central Texas. And we want to be able to have that workforce advocate for policies that promote equitable access to healthcare. And I would also say that our focus on marginalized communities is that when systems are designed to meet the needs of the most marginalized and hardest to reach populations, we can create solutions that make healthcare more accessible and effective for all.
Thank you for that. Folks, we still have a little bit more time. If there are any other questions, please submit them into Q&A, and we'll give us a minute or two to do that. And then we'll kind of wrap up if, oh, thank you. Another question, what should we do if our organization has been muted to use the language of the call in our grant applications, even if we do the work you are describing?
I'm going to need to hear that again one more time.
Yeah. What should we do if our organization itself has been muted to use the language of the call in our grant applications, even if we do the work you are describing?
That is challenging. Alana, do you want to take a crack at that?
Yeah. I think it's all about how you describe the work and the population. I bet there are different ways in which you could describe what diversity or equity means in the English language. So you could use other ways of describing the work that you're doing without lifting up those muted words.
Yeah, I'll just say, yeah, it's not really for us to say. Obviously, you have to follow the guidelines of your organization, as you know, and make it, and make it work between those two.
You've said it is one grant for 24 months. Will the payment come in one lump sum or split into two payments?
Trying to unmute. It will likely come in two payments over the course of 2 years. One, it depends a little bit on the funding amount, but typically it would be half of the award up front and then the second half at the start of the second year.
Thank you for that. Okay, so this is as it relates.
Payments is that they are dependent on financial review and ensuring that an organization is in good financial standing.
Yes. Related to collaboration, would it be appropriate for St. David's Foundation to issue a grant directly to a sub-grantee of the lead organization, with the stated reason being to cut out the middleman? This is being asked in the interest of understanding the proper grant-making protocols and ensuring roles and responsibilities within the original grant structure are respected.
Thank you, Claire, for that question, and thank you, Reggie, for that question. The lead organization that submits the proposal is the organization that will receive the funding from St. David's Foundation if awarded. And the lead organization then can, disperse the funding to the sub-grantee. Is there a possibility for the sub-grantee be the lead applicant for them to receive the funding from St. David's Foundation award?
Thank you for that.
And then one other thing that I'll add regarding the lead organization is that the grant agreement between St. David's Foundation and the lead organization that gets the award, not the sub-grantee.
Thanks, Abena. This next question states many entry-level healthcare jobs, CNA, MA, have starting wages that are not at self-sufficient wage levels for Travis County. Would St. David's still consider supporting these entry-level positions as pathways to sustaining employment?
What we would need to know in that case is what is that pathway? What is the pathway? That there would have to be a clear strategy to move those positions into positions that actually do provide a livable wage. So we would want to hear a lot more about that particular strategy, because ultimately we really do want to ensure that these are careers that are sustainable, that can allow a family to survive and thrive. So we want to hear that.
So I think
Yep.
same time we recognize that this is just a 2-year grant opportunity, and that the pathway may take longer than the 2 years. But being clear in what your plan is to support that individual and getting on that pathway to that self-sustaining wage would be great.
Thank you both. As we kind of wind down our time, we will close our Q&A portion of the webinar. But if you still have questions regarding this call programmatically, please send us an email. That is the best, quickest way to hopefully get an answer to your question or some clarification for your proposal. At questions@stdavidsfoundation.org. If you have technical questions regarding the grantee portal, passwords, things like that, the nuts and bolts of the LOI application, please email grantsinfo at St. David's Foundation. And again, we will send a recording of this webinar and resources regarding the funding opportunity next week. And from all of us, thank you for spending some of your morning with us. We know there's much work to be done in our communities, and so we are grateful for that work, and grateful that we get to uplift that in calls like this. Again, if you have questions, please email us, and have a great rest of your day.
Thanks, everyone.